Hi, I'm Sarah Zanton. I'm the Dean of the Johns Hopkins School of Nursing.
I'm Albert Wu. I am an internist and a professor of health policy and management.
I am Josh Sharfstein. I work as the Vice Dean for Public Health Practice and Community Engagement here at the Johns Hopkins Bloomberg School of Public Health.
I'm Ji Bai. I'm a accounting professor at the Johns Hopkins Carey Business School.
So the business of health is important to consider for many reasons. We spend 20% of our gross domestic product on health or medicine or health-related things or hospitalization. If you look at all that together, we might argue that 20% would be worth it if everyone was extremely healthy. Like, what's more important than health? But we have much higher maternal morbidity and mortality, for example, and lower vaccination rates. You name it. You look at the indicators, and we do a worse job. So it's important that we've got this huge part of the economy that isn't working. And then, of course, from a fundamental human rights perspective, if you look at that, part of society's goal is to help people be well and to have good lives. We're failing, and we're failing expensively.
My goals in general as a practitioner and a researcher and sometime policymaker are to get the best health along with the best quality of life for people. That needs to be delivered on an individual level in a way that's affordable, and at a more population level, it needs to be equitable. I think for both, it needs to provide good value. The business of health is the role of business, both for-profit and nonprofit, alongside other actors in the ecosystem that produces health and quality of life.
There's a lot of money in health in the United States, particularly. We have the most expensive healthcare system in the world, and yet our health outcomes are not very good at all. I think for life expectancy, we're well into the 40s or 50s in terms of the rank around the world, despite being a clear number one in terms of how expensive the healthcare system is. So fundamentally, to me, in public health, the business of health means, how do we get more health for the money that we're spending for healthcare?
Business health is super important because it is related to healthcare delivery and innovation. Think about this. Government cannot do everything. Eventually, healthcare delivery and innovation all depend on the private sector. Therefore, business health is super important for the healthcare status and healthcare outcome and well-being of all Americans now and in the future.